Welcome to Quality Health Finder Clinician Conversations. So today I'm joined by Zachary Martin, a health advisor and author on diabetes. So let's jump in. Most people are aware of prediabetes type 1 and type 2, but what does that actually mean? And is there a type 3 diabetes?
Okay, so when we're talking about diabetes, really what we're talking about is the body's relationship with insulin. So for anybody who doesn't know, insulin is a hormone which helps us to regulate our blood sugar. So for example, your blood sugar has just gone up for whatever reason. Let's say you've had a piece of cake. Your blood sugar goes up. Insulin is a hormone which helps us to bring our blood sugar back down. So what happens is your blood sugar rises, your insulin levels rise, and then your blood sugar returns back to normal, or at least that's what should happen. And that's actually really important because that's where we get a lot of our energy from. So if you've just eaten something and then your blood sugar rises, in order for us to actually utilize the energy from that, the insulin is helping us to do so. So prediabetes is when you are almost a type 2 diabetic. Type 1 diabetes is when your body is simply not able to produce enough insulin. So usually it happens quite young in a person's life, although it can happen a little bit later. But what happens is your pancreas just stops producing insulin or never really started. And as a result, your blood sugar goes up. But then because your insulin hasn't gone up, your blood sugar can't return to normal. So that's type 1. Type 2 is where it's kind of twofold. So the main problem with type 2 is called insulin resistance. So in the beginning, your body is able to produce insulin. The problem is that your body is then rejecting it. So that's where it's called insulin resistance. So your cells essentially become resistant to allowing the insulin to do its job. So your blood sugar goes up, but because your blood sugar has been going up so high so frequently, your body's basically said, you've given me too much to do. Therefore, your blood sugar goes up, your insulin levels go up, but your blood sugar doesn't come back to normal like it should. So the difference between type 1 and type 2 is type 1, blood sugar goes up, insulin doesn't go up. Type 2, blood sugar goes up, insulin does go up, but blood sugar doesn't return to normal because the body's just not responding. If you are quite severely type 2 diabetic, what could happen eventually is that your body also stops producing enough insulin. So it's kind of a double-edged sword. So blood sugar goes up, the body can produce insulin, maybe not enough insulin, and then still the body's not responding to it. So the blood sugar remains high. And the problem with that is that if your blood sugar remains high, it starts to damage different areas of the body. So that's why people go blind, people lose digits and feet and the function in their kidneys. That's why it's so problematic. If you're pre-diabetic, it means that you are on the border between regular and then being type 2 diabetic, which is where a lot of the people who I work with sit in that kind of range. So if your HbA1c result, which is the main marker that they use to test for diabetes, is between 42 and 47, that means you're pre-diabetic. And then anything 48 and above is type 2 diabetic. Type 3 diabetes is really interesting. So the insulin resistance that we were just talking about, where the body is rejecting the insulin and it's not being able to do its job, type 3 diabetes is essentially the term that is being given to people who develop Alzheimer's as a result of insulin resistance up in the brain. Though it's not an official term yet.
And then with pre-diabetes, because we know that there's insulin that's prescribed and some medications that are prescribed for type 2, with pre-diabetes, what's the prescription for that?
It depends. There are some people who will go to the GP and the GP will say, you're pre-diabetic, here, let's start you early. So what they might do is they might prescribe metformin. Depending on their weight these days, they might prescribe some kind of GLP-1 agonist, Mounjaro, Ozempic, stuff like that. But again, it depends on who your GP is. And then others won't prescribe anything until you're diabetic. They will ask you to go away and make some adjustments. So that's where actually I come in, because I teach on the NHS Diabetes Prevention Program. All of the people who are referred onto that program are pre-diabetic. And a lot of people almost become thankful that they were told they were pre-diabetic, because it was a warning. You're not diabetic, but hey, you're going in this direction. Do X, Y, and Z. And that seems to help a lot of people really make the changes that they need to make. And though if you are a type 2 diabetic, you can still reduce your HbA1c number. So both pre-diabetes and type 2 diabetes is reversible. And it does depend on you as a person, because there are other things to consider outside of just lifestyle. So for example, this isn't everybody, but typically people with darker skin. So people who come from the Caribbean, from certain parts of Africa, East and South Asia, they're typically about 4 times more likely to develop type 2 diabetes. And then if you add parents and genetics into that too. So if you've got one parent with type 2, your chances of developing it increase by 15%. Two parents, however, 75% more likely to get it. So if two people who are pre-diabetic both did the exact same things, one of them might experience a greater reduction in their test results, whereas the other person has done the same things. They should just be just as happy with their effort. But because of the other predispositions, they may not experience as much of a reduction, but they should both still take the steps.
And is there an understanding of why there is an ethnicity link?
Partly, it is genetic. So you can inherit it from your family and from your parents. But I don't think that we have an exact understanding yet of why certain groups are more likely to get it.
And so what are the biggest misconceptions that you've come across with type 2 diabetes?
Biggest one is that diabetes is just caused by too much sugar. How long are you going to entirely eliminate sugar from your diet for? In reality, it might work for a month, maybe two, maybe three, but then Christmas comes around and birthdays. And so is it entirely realistic long term? The second problem is that it isn't just sugary food, which will ultimately become glucose in the body. So, for example, I have rice with my dinner. That starch inside of the rice will digest and become glucose, and that glucose will go out into my bloodstream. So with that, it's not just sugar that I have to be aware of. I have to be aware of the fact that there are other foods. The third reason why that is not the best statement to make is that it isn't just what you eat, which influences your risk of developing diabetes. So for example, we just talked about genetics and we just talked about ethnicity, but even other things, like for example, if I'm not active enough, that increases my risk. If I am not sleeping enough, that increases my risk. If I am incredibly stressed, chronic stress can elevate my blood sugar levels. And then outside of that, again, there are other things to consider. Like, for example, a person is depressed. A person with depression is more likely to develop type 2 diabetes. A person with type 2 diabetes is also more likely to develop depression. But my main point is this. If I eliminate sugar from my diet, but I'm still incredibly stressed and I'm not sleeping and I've just started, feeling quite depressed over the last few weeks, well, I could still develop diabetes even though I've cut sugar from my diet. The other misconception I was going to say was that, it's only people who are overweight who develop type 2 diabetes. But actually, I've worked with people who are like stick thin and they are still at risk or have developed type 2 diabetes. There are also people who have lost a lot of weight and they're still at higher risk for a number of other reasons. So that's another common misconception.
Ask, are there any snacks then that a diabetic can reach for that are healthier?
The best snacks that you can reach for are the ones that have more nutrients. So let's say if I was reaching for a piece of chocolate. It's got a lot of sugar in it and it's got, some fat in there, but really it's just high in sugar. Whereas if I picked up a different item and this item also had some protein in it and it had some fiber in it, it would mean that when I'm digesting it, it would digest slower. You see, because carbohydrates typically digest faster than fat, fiber, and protein. So let's say I had a snack and one option was the chocolate and then the other option was some kind of oat cake. And the oat cake had some fiber in it and maybe it had some seeds on top. Maybe it had some chocolate in there as well. But because now I've got the presence of fat, fiber, and protein, that snack will digest slower. So instead of it going down and going and extending out to my blood, instead, it goes down and it goes slower. So now it kind of drip feeds into my blood rather than just going straight in and causing my blood sugar to rise very high and very fast. Whenever a person can add those three nutrients to their meal, way better. So that means instead of having Pringles, I have lentil chips or lentil crisps. Instead of having a chocolate bar, I have a flapjack or I have a handful of nuts. That is typically what I recommend in terms of swaps. However, the cool thing is that you don't necessarily have to eliminate foods from your diet, because I'm really big on keeping foods in your diet that you enjoy. Mainly because I'm quite a foodie myself, so I like to have my sweet treats. But there are a couple things that you can do. So let's say you've walked into your kitchen and there's a piece of cake waiting for you and it's calling your name. If you were to go and eat that on an empty stomach, it would affect your blood sugar more than if you were to wait and have it after your meal as a dessert. Because same thing as before. I eat it on an empty stomach. It will now digest faster because there's nothing else being digested currently. As a result, digest quickly, go into my bloodstream faster. Whereas if I have just eaten a meal, particularly a meal that has more fat, fiber, and protein, that's digesting slower, that has now slowed my overall digestion, which means that that cake has to basically get in line and now will digest slower as a result. So you can quite literally have your cake and eat it too.
Good, very good. And so somebody at home who has the beginnings of type 2 diabetes but is unaware, what symptoms may they be experiencing?
I'll go through a few of the niche ones, but the main ones that you hear about is being excessively thirsty, going to the toilet more frequently than you're used to, having trouble with your eyes is a big one. So if your prescription has gotten worse quicker than it has done in the past, that could be a bad sign. Or let's say you've got blurry vision or even floaters. Those are all pretty bad signs. I would recommend that everybody gets tested, especially if you're north side of 40, ask them to test your HbA1c just to be sure.
Many people are handed a diagnosis of type 2 diabetes, but then completely lost. And what made you want to simplify that journey in your book?
I realized that a lot of this information that I teach about is not common knowledge. So just putting that information out there in a simple way, I think was important. And then the other side was that a lot of the time, even if you're looking at a resource which states that it is very holistic in its approach towards treating diabetes, it doesn't always include the big picture. And so there are factors that are often missed out. Not to say that any of these resources, any of the NHS stuff is bad or anything like that. The program that I teach on is very in-depth. I just thought that there could be a little bit more that could be added. And I also liked the idea of making a resource which wasn't clinical, but was more like storybook and colorful, mainly because that's also the way I think. So like all the pictures that you see in there, that's more of a representation of the way that I think and visualize things.
So tell us a bit about you, Zach, what your work as a health advisor looks like on a day-to-day basis.
Okay, so right now is quite a busy period. The main thing I'm doing is running talks for the NHS. So I'm going around East London at the moment and I'm delivering sessions for the NHS Diabetes Prevention Program. I'm also running a lot more of my own workshops. I created my own health program, which goes into more topics than just diabetes. So I teach about heart disease and cholesterol and anxiety, depression and nutrition and there's a lot of crossover, but there's more to it. And now I've been running those workshops for different companies and charities. So I'm working with a charity right now called Helen Rollason Cancer Charity. I'm a qualified personal trainer. I've just started teaching water aerobics, which has been fun. I've also got my own little swim team who I teach every week. So I've been teaching swimming since I was like 16. And then the book stuff. So I've been very busy recently, so I've been enjoying it.
So the water classes that you do and then the PT, is that just for diabetic patients?
So if anybody did want me to do some personal training with them, I do training for everybody. But the water aerobics classes that I do are only at David Lloyd in Chigwell right now. So if anybody is a member or fancied coming in to do one of my classes, that's where I host those.
Well, thank you for also becoming a member of Quality Health Finder. It's our UK platform designed to help patients find trusted care. So as you know, we're inviting healthcare professionals to join ahead of public launch. So what made you register, Zach? And why do you think platforms like this are important?
I like what you're doing and what it represents. I love what the NHS does and what they stand for. But at the same time, the NHS is under a lot of pressure. And I think that what you're doing could help relieve a lot of that pressure when people realize that there are options outside of the NHS. And if someone can go onto your platform and then find one of my seminars, or can go onto your platform and can find a private chiropractor who can see them next week rather than in 6 weeks, that not only will help them, but that will help to release some of the burden on the NHS. So I just think that you're filling a good gap, which is just helping people connect to the right healthcare professionals.
Oh, it's much appreciated because we do feel really strongly about it. And it is making sure that patients' pathway to care is expedited. But back to you. So if people want to find out more about you before Quality Health Finder goes live to the public, how can they reach you? And also, what's the name of your book and where can they get it?
The book is called Zach's Guide to Type 2 Diabetes and Good Health. It is available on Amazon, the Great British Bookshop, and in person if you come along to one of my seminars that I teach in Chelmsford and in Dagenham. If you want to find out more information, my website is zmpt-health.com. And on there, there's also videos of me teaching seminars. So if you wanted to attend a seminar, but you live too far away, you could actually watch my entire program. Everything is going to be on the website very soon. There are also some resources on there. So if you need some extra support, or if you wanted to download the resources that are inside this, you could get it on the website as well. And then if you want to find me on Instagram, it is Zachary Martin PT.
I will make sure that I put the information about your book and how you can be contacted in the description below. If you enjoyed this conversation, please share, like, and subscribe, and we'll be sharing more conversations with clinicians very soon.